I've wanted to be a doctor for a very long time as a kid, but I didn't have doctors in my family. I'm a first generation medical student, so I didn't know any. I was an athlete growing up, very into sports, but I struggled a lot with injuries. But what really stood out to me through that experience was the physicians that took care of me. They spoke to me in a level that I understood and showed me so much compassion and made a terrible experience more bearable, and I knew that I was called to care for people in that same way. It's an honor to be named an ElevateMeD Scholar. I was very overwhelmed when I first found out. I was honored that they chose me, but I'm really excited to be a part of the program. I love what it stands for. I love that it's unique for a scholarship program where you get to be invested in, but you also get the opportunity to invest in future generations that come after you. A lot of the times, urban populations, I call them the forgotten ones, the people that are in these bigger cities like Tulsa, Oklahoma City, who may not meet the cutoff for rural or may make too much for certain insurances, but are trying to make ends meet in those urban cities. I knew that was the population that I wanted to focus on, having come from those populations myself, and having the opportunity to rotate in urban cities and focus kind of my clinical rotations on those populations has been really great for me. Patients who look like me, a lot of them will trust you with, their health and want to share things with you and know that you understand because you come from that diverse background. And so I think it's important for populations that look like me to know that there are physicians out there that understand their health concerns and are sensitive to those and are working from the inside out to advocate for the populations that we represent.